Good morning. My name is Tom Bannard. I am really grateful to be with you this morning for the Family Recovery Conference. And I just want to say I'm honored to do this. Shelley is a great advocate for people in recovery and their families, and it's been fun to get to know her a little bit over the last few years. Um, I believe that it's a tremendous honor to work with families that are impacted by substance use disorders. And so it's always awesome to share a message at all that gives hope to families, that gives resources to families, that maybe helps them address their loved one's addiction in a more effective way. I have run a family education program. This is our 7th year of doing that in Richmond, and it's been a really cool model of community collaboration from local providers here, from faculty at Virginia Commonwealth University, from folks at local nonprofits, and we run a weekly group for families that is really education focused, and it has taught me so much about addiction, about working with families, just about being human. So I think of that family group as my own exercise in what Chris Budnick calls clinical humility, that we are not nearly as smart as we need to be about addiction. We're not nearly as good as treating addiction as we need to be. And what I found for a long time working in a residential facility is that you get into this feedback loop where you're always right. You know, the participants that follow all your directions and stick around do really well. And those who don't follow your directions and come back don't do well. And that's very evident. And then it's this proof that you're right all the time. But you don't often see or hear from some of the folks that didn't really follow your directions. And some of them, of course, do fine. And, others may have been much more successful under somebody else's care in a different approach. And so what I've found in working with families for the last 7 years is, you see families that just do a wonderful job of loving their children, of setting some appropriate boundaries, giving them access to care and treatment. And they do all these really positive things that should shift their loved ones' odds. And sometimes they have terrible results anyway. And then you see some families that kind of don't do exactly what you guide them to do. And sometimes their loved ones do just fine and thrive in recovery. So it goes to show you that we really don't know it all. And I'm always, anytime I have a chance to learn something about addiction, I want to do that because it might save somebody's life. So that's just kind of a little bit of my intro. I am a person in long-term recovery. That means I haven't used a substance since December 6th, 2006. It means that, frankly, everything good in my life is a result of being in recovery. And that includes really good relationships in my family. And I was very blessed that my family got high-quality care and really good education around addiction and some really good guidance. So my hope is for every family to have those opportunities. So we're going to get into the talk here, and hope you'll be patient with me as I play with our new technology. Let's see what we got here. My talk is titled Craft and 10 Things People with Substance Use Disorders Wish Their Families Understood. And then in parentheses, it says, but would never tell them. So there's a bit of this talk that's a little bit tongue in cheek, and this is never meant to demean anyone with a substance use disorder or their family members. And I also think we got to find a way to deal with this. This is really a really tough thing to deal with, and sometimes humor can carry us through some things. So I hope that you'll find it humorous and not offensive when we kind of have these little asides. But take them as you will. The experience of loving somebody with a substance use disorder is not clean and polite, and perhaps if it was, so we use a little language in here, and that sort of thing. And, if dealing with someone's substance use was clean and polite and all that stuff, then we'd probably be able to talk about it a little bit more than we would. So I'll try to use kind of the language of my people. I was in a meeting the other day that said, please don't cuss unless it's absolutely necessary. So anyway, that's I'm trying to do that. So let's get rolling. The first thing I want to say is that I love this. If there's like kind of a Bible for dealing with a loved one's substance use, it's this wonderful book by Robert Myers and Brenda Wolfe, Get Your Loved One Sober, which just gives you some different skills and different ideas about dealing with a loved one's addiction. And it's kind of a primer on CRAFT, which is community reinforcement and family training. There's actually some great videos now where you can do that, use CRAFT and get a primer on using CRAFT. And Partnership for Drug-Free Kids has some wonderful resources on CRAFT as well, as does the Center for Motivation and Change. They'll even send you a kind of a daily CRAFT-inspired message about your loved one, and kind of just tips and tricks. So that's a great resource. So I'll say a lot of this, and so my interpretation of CRAFT, of the way that CRAFT works, and this is totally my stuff. This is not Robert Myers. I don't think, though. I hope that he would largely agree with this. That it starts, inertia is really powerful. So objects in motion tend to stay in motion, and objects that are stuck tend to stay stuck. So I really encourage families to do something. How do I get moving? Because addiction can really keep us stuck. With that, I think that the first thing that happens is a family member changes the dance steps or changes their approach. And sometimes that immediately results in the person with substance use disorder engaging in treatment, but often it doesn't. And I think as that approach changes, maybe that family member increases their empathy. They recognize some of the patterns of use that their loved one has. They're starting to do things a little different. They're starting to reinforce positive behaviors, not focus as much on the negative behaviors, and certainly kind of stop confronting people while they're intoxicated and that sort of thing. But also allow that person to feel some of the natural consequences for their behaviors. And I want you to hear me. This is not imposing punishment, right? This is about allowing adults usually to experience kind of the consequences of their behavior and to kind of learn from them. I think that's just kind of a helpful way to frame it. It shouldn't really be, hopefully it's not the family member's role, especially once that person is 18, to be a punisher. It's more of allowing the natural consequences of behavior to happen and giving that person the dignity to deal with those on their own. And then eventually we hope that person will engage in treatment. So really the goal of CRAFT is to get someone engaged in treatment. That's really what we're working for. So let's start with this first number one, which is this: I'm not bad, I'm sick. But I do bad things. And this is this is the crux of how difficult it is to have a loved one struggling with addiction. This is where a lot of our shame comes in, and where societally our instinct to punish is that people under the influences of substances often do bad things, right? And alcohol is probably the worst, you know, allowing or creating bad things to happen, but certainly the case with other substances as well. And so, you know, how do I, in the presence as a family member, in the presence of what just looks like, you know, bad behavior, you know, how do I keep in mind that this person is working with a broken brain, right? And so we have a pretty substantial amount of research that says that this is a chronic medical condition, and that it's a dysfunction of reward and memory and related circuitry, that, you know, people's brains are messed up. They're not playing with a full deck of cards, and so they're short-circuited to do these things that allow for immediate or short-term rewards. And just as a family member, it's just a whole lot more productive approach to think of them as, you know, as kind of a sick person rather than a bad person. So, the next one is, you know, it goes along with this bad behavior or doing bad things, that I may lie sometimes, but not everything I say is a lie. Good luck telling the difference. You know, that's difficult. I have a little meme about this. You know, a lot of, especially parents, have experienced this with their children, you know, both children that are struggling with substance use disorder and those who are not. But it turns out some of the best that struggle with substance use disorder have really wildly creative memories, creative interpretations of events, and so that's really a challenge to deal with as a loved one, because, you know, you often know your sensors are up. You often know that they're lying. So I want to suggest another approach, which is this kind of ability to try to practice observing without judgment, and that, okay, you may know, or you may be suspicious that your loved one's being dishonest, and you know, maybe this is a great time to practice some deep breathing and some really working hard to understand what is kind of underneath that dishonesty. I think that you know, some of the lies that we tell as folks active when folks are active in their addiction is to protect their use, and you know, so thinking about, okay, what's this person's motivation for kind of this particular dishonesty, but also we will often say things like, I don't know why I keep using. And I think that that's more true than sometimes we like to think, is that, gosh, some folks, you know, addiction is really baffling. And some folks don't know why they picked up at any given time, even despite, you know, loads of consequences. It's just the power of addiction. So to kind of keep an eye on that, and that as somebody gets into recovery, it's really important to rebuild that trust. And so finding the right balance between kind of observing without judging, and also trying to reinforce and trust, rebuild trust over time is really important. So the next one kind of plays into that a little bit. I'm not in as much denial as it appears, but try to get me to admit it. So most people are ambivalent about most changes most of the time, right? And this couldn't be more true with substance use disorders. And so we have to kind of allow for that, that most of the time somebody's not just going to jump out and say, oh, I want to jump into recovery, take me to treatment. They're really going to be in more of a, I know I've got some consequences, but what we have to remember about substances for folks is they're often solving problems, right? It's not just about, oh, this substance is destroying my life, but it also is probably solving something for me. And so I'm balancing this thing that has worked for me for a while, maybe not working so well right now, with, oh my gosh, these consequences are piling up in my life. And what do I do about this? And so, that's the challenge of addiction, is that, this is something that's working for this person in some ways. And so they're trying to work it all out themselves, work out this ambivalence. So one of the tools that we use, which I think at least is conceptually helpful to folks, that family members, is motivational interviewing. And one of the kind of core pieces of motivational interviewing is Prochaska and De Clemente's stages of change. And I like to, this is often done in a circle. I really prefer, when working with addiction, working with families, to look at this linearly. And I probably, it would be more correct to have these arrows kind of going both directions, meaning people move up and down in stages of change. And the reason I like this kind of linear is that the problem with the circle is you kind of assume if you have a return to use that person goes all the way back to pre-contemplation, and like, it's, you're shot, everything's shot. Whereas more typically they're moving back into preparation. And if we can re-engage quickly, then the damage doesn't have to be enormous. And I've definitely seen that with folks in recovery, is if you can get re-engaged with them quickly after a return to use, then we can get them back into the action and the maintenance stage quite quickly. We don't have to go all the way back to the beginning. So just a couple of ideas about how this might be helpful to you as a family member. So the stages of change kind of acknowledge that ambivalence is normal, right? This not sure if you want to change or not. That's a pretty normal human thing. So we start that with pre-contemplation. There's no intention to change a behavior at all, right? That moves to contemplation. Okay, so there's a problem here. Maybe I'm thinking about it, but I'm not really doing anything. I'm kind of weighing the challenges there. Then preparation. So I think I'm going to take some actions. I don't know what that looks like. Maybe I'm doing some research. Maybe I'm kind of looking into options. I'm kind of taking some pre-action, some pre-recovery actions. And then action, right? So I'm actively moving forward. Maybe I'm starting to go to some meetings, or maybe I'm really, I've had been seeing a therapist in preparation, and now I might be going to an intensive outpatient. And then maintenance, how do I sustain that change, which is crucial with recovery. Like, if we're going to treat this as a chronic condition, let's treat it over the long term. So that maintenance, we really need to emphasize how important that piece is. So what this helps us with is that first, I think the tendency for folks is that, and understanding, move my little head out of the way, that as people move through this, their motivation tends to move from external to internal, right? Got a lot of outside pressure encouraging me to make changes, to eventually, oh my gosh, these changes have really been really important to me and are becoming part of who I am. And so that is where kind of when people experience some natural consequences of their behavior, that can actually be quite helpful, especially early on in this process. It also kind of changes what we do, either as therapists, or especially as family members, that different actions are appropriate during different times here. So early on, it can be quite important, right? If we're going to move somebody out of pre-contemplation to decrease the desirability of using. So this is where external consequences coming in, while also practicing some empathy, right? Gosh, I'm really sorry that happened. That must be really hard for you. It doesn't necessarily mean that we need to jump in and kind of fix that, but we can express care and concern while also giving people the dignity to solve their own problems. As we move kind of from contemplation to preparation, or we're trying to help that person move there, we may be providing some feedback. I noticed this, right? And in a school context, we might say something like, "Oh, gosh, I noticed that you have a lot of trouble showing up to class on Friday. I also know that you want to go to med school." So we're trying to kind of create some discrepancy between their behavior and their goals, right? But most importantly, we're doing that in a non-judgmental way. And you can kind of figure out, okay, how do I navigate that? That's the devil is in the details, of course. It sounds like so easy, but I know it is really, really challenging. The other thing to keep in mind as a family member is, right, that this is kind of a process that people go through at different paces. And for us to expect somebody to jump from pre-contemplation all the way into action, that's probably not a realistic expectation, right? So we want to kind of help them along in this process, and kind of just not force this, but to try to the consequences may be really obvious to us, but it may take them some time to catch up to that person. So I do think as it moves forward, right, we want to start providing some choice. So I coach families to, already have some options for rehab, for, treatment for that person, so that when they get to this preparation stage and they call and they say, "Mom or Dad, hey, I really need some help," or, husband, wife, "I really need some help. Hey, so it happens that I know that these 3 facilities, like, what seems appealing to you?" And kind of, allow them to have some buy-in in that process, but, also give them the dignity of making some choices for themselves. It can be really helpful to kind of help people clarify their goals. This is where that med school example might be helpful, right? Like, I know you want to go to med school, or I know you want to go to college. It's harder to go to college if you have criminal convictions. So you're kind of creating some discrepancy between their behavior and their intention, and other goals that are important to them. As people move towards this action stage, we want to remove barriers. So, oh gosh, well, we have your bags packed, you're ready to go to rehab. What we know with substance use disorders is that we know that we often will only have a pretty small window where somebody's willing to make a change, right? And we really want to be ready and capitalize on that change. And so as people move towards these actions maintenance stages, we want to take away some of those barriers, right? So if we can, take away some of the affordability barriers, or take away the barriers of navigating a very broken system, we want to do that. And this last one is active helping, right? Active helping may not be very appropriate at pre-contemplation and contemplation, but in the action stage, this might be driving somebody to rehab. It may be maybe getting them to a meeting, right? As they're committing to their actions, you're supporting those actions in a more tangible way, and often that's very appropriate. I think we get into trouble sometimes where we do kind of too much active helping before that person has kind of made their internal commitment to change. And so it's often a very good thing to be an active helper, but we want to be thoughtful about the timing of that. Okay, so we're going to move on. This is a busy slide, but I hope that's helpful. So I don't hate you as much as you think I do, and I know this is not always the case, but often there's kind of these big disagreements, to put it mildly, in families impacted by addiction, and that seems to be part of the deal here. And so this is kind of oh, I hate you, Mom, is often sometimes something we say, as we're often quite selfish in active addiction, as kind of the brain, our priorities are all messed up. So I don't hate you as much as you think I do, but I will tell you, take a walk. And I think this highlights the unfortunately the ugliness of addiction, and why it's often really hard to talk to people, to get support from family members, and or from friends, because we think, oh, this is not going on in anybody else's house, and this is something I somehow have to be ashamed of, and that shame is really keeps us from getting help and support when there are some folks who will help us and support us and who get it. And I think that's the beauty of this conference, is that you can kind of quietly get some of that support, and then take some additional actions to kind of build a tribe for yourself. So I should have blocked this off, but anyway, it's real. So I don't know. I'm sure you've been there. Okay. So moving on, I had this idea. I don't know what I need, but I sure will tell you that I do. Right. So Mark Fishman gives a great example of a young guy who's long-term opiate user who goes into a detox for the fifth, sixth, seventh, eighth time. Hasn't been successful in the past, but it goes into detox and says, "Doc, I really need to be out Thursday. I've got a date with my girlfriend." So this kind of incredible myopia that is, self-focus and lack of insight into the strength of our addiction and our behavior is really characteristic of substance use disorders. So that kind of blind spot that we have around, our own actions, you see this playing out in this kind of really toxic relationships early in recovery, that there's this incredible lack of insight into our behavior and how our behavior impacts other people during active addiction. And so this is where we need to balance, like, our loved ones' need for some autonomy and some empowerment with the reality that they often really can't see the extent of how much their addiction is impacting them. So they have this huge blind spot. So this is where families getting educated and families resourcing themselves really can make a huge difference. So I show the slide of the continuum of care, and I'm sure you'll hear more about this throughout the weekend, but this is in my humble opinion. So this is not like expert, but just this is the way I've seen it play out in our community, though. Frankly, it's the exception rather than the rule. Somebody gets this whole continuum. So you have this unknown period of resource gathering and crisis. That could be a year, and it could be 50 years, unfortunately. But at some point, you may well be encountered with an opportunity to intervene. Now, if we were really good at this, we would be doing more short-term, screening type interventions in doctors' offices and that sort of thing. But we unfortunately don't do that a lot. So often there's a detox or hospitalization or incarceration or some crisis that gets someone initially engaged in treatment. Unfortunately, there's an access gap there in many places where people don't have access to the treatment that they need. And then they have, a short, then they should be kind of going into usually residential care. And I have to admit there's an error on my slide here. That intensive inpatient technically means a hospital setting. So it's really what we're talking about, 30-day treatment or residential care and extended residential care or outpatient care here, the 90-day mark. Unfortunately, we don't do a very good job of connecting people to each next level of care, and we do a really lousy job of ongoing recovery support. So, 12-step does a great job with ongoing recovery support, but that's not really, it's not part of our professional, in the current system of care, it's too often not part of our professional responsibility to provide that care from 4 months to 5 years. And it really should be, because recovery doesn't really stabilize until at least 5 years out. And so we as professionals have more responsibility there than we really take on. And so you're starting to see a little bit better aftercare, certainly. And with healthcare professionals, they have very good recovery support, ongoing care. But in general, we do a really lousy job of this period of 4 months to 5 years. But you as a family member, and especially in places where we have really horrific substance use disorder treatment like Virginia, family members can play this really critical role in filling in these gaps and connecting people place by place through these gaps, because most providers do not have this whole continuum of care in one place. So, so that's kind of the continuum of care, and something that for you to kind of keep learning more about, because it's a key role. You can be a connector and educator as a family member, and that's a really important role that you can play. So our sixth one is consistency matters, but not for me. That's the voice of those of us with substance use disorder. So we are often horribly inconsistent, but it does really matter for family members. And I think that having that stable presence of, like, I know where my loved one stands on this, and they can they stand pretty consistently, then while you're in active addiction, hey, when it's time to get help, I know that I can go to mom for help, or I know that I can go to dad for help, and be that point of engagement. What happens when we're inconsistent, right? And so I come to my mom and say, can I have the car? Can I have the car? Can I have the car? No, no, no. Can I have the car? Can I have the car? No, no, no. Can I have the car? Okay, fine, take the car, right? What happens there is we get intermittently reinforced behavior, right? Which is actually a much stronger predictor of ongoing. It creates ongoing repeated behavior even better than consistent reinforcement, right? And so I think that's helpful to think about, right? Is that we want to be consistent. Doesn't mean that we can't change our mind, but we want to kind of have a consistent stance on things. And this is where kind of doing your homework as a family member first, as you figure it out, can really be helpful, and kind of get solid and stable on your own, as difficult as that is, where you can be really consistent around, okay, how do I want to show up to this relationship with my loved one that has this disease that really impairs their judgment? And then I've got a couple of memes for you. Here's a couples therapy one. And then this this one, they give you a lot of treats while they're training you, so play dumb for as long as you can. So I've got some dogs at home that have learned this really well. So anyway, okay. So all right, this is really important, right? Because there's some unpredictability and there's some danger to substance use disorder, or we wouldn't, it wouldn't have the impact that it does. So telling me that you care never hurts. And, it might not change my behavior though. I've never met somebody in recovery or active addiction that was like, gosh, really wish my loved ones would stop telling me that they love me. And giving that person connection to the world and know that they're valued and know that you care about them is just really, really important. Sure, it may not change behavior, but you won't regret telling your loved one that you love them. So I really emphasize that to folks. There's some folks that work in the treatment industry that are all about tough love. I'm not a fan of that word, but my belief is that tough love without tangible care is just tough. It's just no good. So cutting somebody off without any possibility for treatment or reconnection, more often than not, it's really not a good thing. I do love this book by Jeff J. and Deborah J. Called Love First, which really emphasizes that, sure, there's some things we can do as family members. We may not, have even the majority of the control of what our loved ones do, but what we do does matter, and we can be an opportunity for that person to get help and to get treatment. When you do things for me that I can do for myself, I feel useless. But please do them anyway, right? That doesn't mean that we're not going to ask you to do these things for us. It is disempowering, right, to do things for people that they can do for themselves, right? So I'm not a fan of enabling or codependency. Those terms and labels, I think, are pretty often unproductive and quite harmful to family members. They're often kind of held over family members' head in a really negative way. But I do think, this is where there's some discernment that comes in, is that we need people to kind of reclaim some agency in their life. And when we do things for them that they can do, it does create some challenges, right? So the devil is in the detail here. And this is where we really don't want to walk through this experience alone. It's just can be so important for family members to make sure that you're getting care and support from the folks in your life, because walking through this alone it's too difficult. It's too hard a disease to try to do this whole thing on your own. So just encourage you to get some support as you navigate this, because it's not a black or white thing, right? Like, can this person do this for themselves, or are they in a place where they can't do this for themselves? And so this is where we need help, right? A friend of mine describes it as, the book is so close to my face that I can't read it, and I need somebody in my life that can hold the book a little farther away from their face, so they can kind of see and help this sort this out. So these are really challenging decisions that we're having to make on a daily basis, and getting some help and some support really matters. One of the areas that I think that this is not so much the case in is the this area of navigating what is a very broken system in our society, right? So this is our mental health services access guide. I know you've been looking for it for a while, and I've provided it for you. It's just challenge navigating this whole thing. I don't know. I mean, maybe this hasn't been your experience, but it's really hard to figure out, where do I get treatment? And we think about somebody that has a brain disease, a chronic condition that is affecting their brain, and how do we help them navigate this very broken system? It's really hard. And so we want, this is where families can really help, is that they can really help navigate this very broken system, and find treatment options and get educated. So again, we got these are the paradoxes of recovery and family members. And I need to figure this out for myself. But I also need the right kind of support, right? Which kind of supports this kind of helping people figure out how to access treatment and sort out what's quality treatment, what's not, right? We see a lot of people being taken advantage of. There's a lot of difficult choices on a day-to-day basis. We have to figure out, okay, what's the best way for me to support my loved one in navigating this really hard disease. And so I don't think there's any hard or fast rules, around this. I think this is where we need community to help us walk through, and what's the appropriate way for me to support my loved one. It's just a challenge, but the right kind of support is often, making sure that your loved one knows that you love them and you care about them, giving them some grace to make their own mistakes, giving them second chances and third chances and fourth chances, without with still having some wisdom about what those things are. I think that this is a hard challenge. So we like to, I think that as counselors, we often think that the choices or we often make you think that the choices you have are relatively simple, like this kind of choice here in the morning. But obviously, it's a lot more complicated, and it's just where having a circle of people you trust that you can run things by. Again, just want to emphasize how much that matters, and folks that won't judge you, right? Just as you're trying to not judge your loved one. Our last one here is, it is important to me that you are okay, but I lack the capacity to think about your needs above my own. So I would say that this was the case for me even well into my recovery, that, I was a year and a half, 2 years sober, and I was calling my folks, and I realized, I'm not, every time I call my folks, I'm asking for something. I need something. I want something. This is so hard. It's really hard to, as a loved one, as somebody that has impacted people in a really negative way in my active addiction, always loved and cared about my parents and my family members. And I just was incapable of showing up the way that I wanted to show up. But obviously I always wanted them to be okay. And this is where, maybe I'll say some things that I don't mean while, a loved one's trying to navigate this really traumatizing experience. But, at any time where I would be my better self, I would know I want my folks, I want my family to be okay regardless of what's happening with me, and that for them to take care of themselves, to do those things that make them happy, and ultimately, like, I know that when they do those things, they're going to be in a better place to show up for me. So doing the things to take care of yourselves, to move forward, still be compassionate, still be non-judgmental, but you got to take care of yourself, and you got to get support, just as if you had a loved one that had cancer or another chronic condition. Taking care of yourself is really important. And I never met anyone that was like, gosh, I wish my family would just stop taking care of themselves. And, that for a loved one to be able to take care of themselves, it actually relieves some of the guilt of addiction. So I think that's just so important. So this is all from me. That's a long time to listen to somebody and have this box move around all over the screen, but I'm available. So please reach out to me. I run the Collegiate Recovery Program at Virginia Commonwealth University, and we'd love to have your loved ones here as they heal and as they figure out what's next for them. And just really grateful and honored to be a part of this. And I look forward to hearing some of the other talks. Take care.